It is a great satisfaction to greet you, and I hope you find yourself well, both you and your pet. In today's video we will talk about the following. Why does a puppy vomit? Causes and what to do. Let's find out now. Vomiting is a sign of multiple illnesses. It is often associated with the presence of gastric disease. However, there are other causes outside the stomach, even outside the digestive system, that can cause vomiting in puppies. If you are concerned about your puppy vomiting, I recommend that you continue watching this video in which we explain what the main causes of vomiting in puppies are. Causes of vomiting in puppies. Vomiting is the expulsion of the contents of the stomach through the mouth. However, there are several causes that can cause vomiting as a clinical sign. Here are the main causes of vomiting in puppies. 1. Digestive diseases. These diseases can affect different sections of the digestive tract, including the stomach, small intestine, or large intestine. Digestive disorders that can cause vomiting in puppies are obstructive disorders, by ingestion of foreign bodies, typical of very nervous puppies. Enteric infections, viral, bacterial, or parasitic. In puppies, the most common infections are caused by viruses such as parvovirus, coronavirus, canine distemper virus, or canine viral hepatitis. These processes usually appear from 6 to 14 weeks of life, when maternal immunity begins to decline. Inflammatory diseases can affect the stomach, gastritis, small intestine, enteritis, or large intestine, colitis. 2. Stimulation of the vomiting center. The vomiting center is at the level of the brainstem and is responsible for regulating the vomiting mechanism. This center can be stimulated by substances present in the blood or by some diseases such as neurological diseases, drugs, toxic substances. 3. Psychogenic causes. Psychogenic causes include fear, stress, and pain. We must bear in mind that puppies are especially sensitive to stressful situations, which can trigger vomiting. Types of vomiting in puppies. Once we have confirmed that our puppy is vomiting, we can look at some characteristics of the type of vomiting that will help guide the diagnosis. There are different types of vomit depending on the content, so you should observe if it is bilious vomit, greenish due to the presence of bile, fecaloid, with the appearance of stool, if it contains undigested or partially digested food, if it has traces of blood fresh, red, or digested, dark, and if it contains foam or mucus. An acute episode of vomiting is when it lasts less than 4 to 5 days, and chronic vomiting when it lasts more than 5 days. Acute processes are usually associated with intoxication, drugs, or visceral pain, while chronic processes are usually associated with digestive and neurological diseases. You should pay attention to whether the vomiting occurs immediately after eating the food, after some time, usually 1 to 2 hours, although it may be longer, or if it does not seem to have any apparent relationship with the food. In diseases such as gastritis, it is typical for vomiting to occur on an empty stomach first thing in the morning. What to do if your puppy vomits? When your puppy presents a vomiting picture, regardless of the type it is important that you go to your veterinarian as soon as possible so that a diagnosis can begin to determine the cause and establish the most appropriate treatment. Vomiting has a number of clinical consequences that can be especially serious in puppies, because they are weaker and immature animals. In these cases, it is important to act quickly as delaying diagnosis and treatment will complicate the animal's prognosis. What to give a puppy if he vomits? As for food, fasting is not recommended, as it can delay the recovery of the digestive system. Ideally, give him a highly digestible diet, low in fat and low in fiber. To do this, you can opt for a homemade diet, for example, based on rice and cooked chicken, or you can use gastrointestinal feed specifically designed for dogs with digestive diseases. Regardless of the option you choose, it is important that you distribute the food in more doses throughout the day to avoid overloading the digestive system. It does not mean that the amount of food should be increased, it should simply be distributed in more doses. Although fasting is not indicated in most processes with vomiting, there are some very specific cases where it is recommended. Fasting. Should you administer drugs to a vomiting puppy? In some cases, such as pancreatitis or some types of gastroenteritis, it may be an appropriate symptomatic treatment. However, on other occasions, administering drugs to a vomiting animal can have fatal consequences. On the one hand, you must bear in mind that vomiting can be a defense mechanism that the body uses to eliminate toxic substances, foreign bodies, or infectious agents from the body. Therefore, in these cases the use of drugs will be counterproductive. Therefore, you should never give your puppy an antiemetic drug if it has not been previously prescribed by your veterinarian. Would you like to have more professional information, and especially updated about your dog? Visit the website below in the description of this video. Do not stop subscribing to the channel, comment, and share the video. You are very well, thank you.